Hello. Welcome to another episode of Think Out Loud. I have three beautiful guests here. We'll start with Salome to introduce yourself.
Hi, my name is Salome. I am a registered nurse here in Halifax. I work on unit burns and plastics, general surgery, vascular surgery, and I also work in mental health.
Perfect. Okay, so my name is Miriam, and I'm a Dalhousie nursing student in my final year of nursing. And and I'm basically interested in like maternity or pediatrics or anything along those lines, and mental health. So something around there.
My name is Aisha, and I'm going into my second year of nursing, so I just finished semester 3, finally. And my interest is more in like pediatrics, maternity, prenatal care, like that area.
All right. So my first question is, why nursing for you guys? Why do nursing?
My mom always encouraged me to do nursing. But for me, I think the biggest thing that took it home is that I get to travel and I get to help people. So those were the two things. And I think as a child going back home to Ethiopia, when I saw people, I just always wanted to help them. So I thought that was the best way for me to go about helping people. And even in the future, I hope to go back to third world countries and help them as well.
I love that. Mine's definitely very similar. Like I found like I just loved helping people, and I loved how it made me feel, like help someone that needed it. And I just loved the essence of that. I'm from Sierra Leone, and there's people that need help back there, so being in a position where I know I could help and go back one day and help like means a lot to me.
For me, so nursing, I'm not sure anymore, but personally to start off with, nursing actually wasn't my end goal. I hopefully want to become a doctor one day, but I'm not sure if that is the route to go with the way I want to do things, because same thing, like I come from a country that doesn't have the best type of healthcare system. So my end goal is to hopefully one day build like an integrative clinic, because a lot of my cousins back home are doing medicine, and hopefully have all of those professions being able to provide like substantial care without it being so expensive to the people that are there. But yeah, as a nurse, I feel like that's something that I could definitely do as well. So it's still, and I can do it quicker. So it's still a practice that I can still work with. But yeah.
So as of right now, you're the only one who practices nursing here, like in Halifax, right? Can you expand a bit more on what you do on like a daily basis once you get to work?
It depends on what unit. So mental health, I find, is a lot of kind of counseling, monitoring behaviors. You get lots of different patients with different needs, and you give them their medication. You talk to them, how are they doing? You get people who hear voices, you get people who are suicidal, people who are depressed, people who are very manic. So it's a lot of like kind of behavioral, providing them with structure, guiding and counseling them. Where on the medical surgical side, it's very routine, very task oriented. So you go in, you do your vitals. Based on your vitals, you give medications. You do blood work. Based on blood work, you give certain other medications. So in vascular, you deal with a lot of people who have amputation. Your day varies a lot. If I went into detail about my whole day, it would be a long video.
Here for some time.
So those are kind of the things that I do on the units that I work.
Have you guys had like placements before? Like
I haven't because of COVID. So I was supposed to do it at the end of July, but because of COVID, we're going to be working in like the long-term care facilities. So it was, with us not having any clinical experience at all before this, it was kind of dangerous for us to go in, and then for them as well as like patients to go into those facilities where they already had many cases. So they canceled our clinical, but hopefully in September we're going to be doing that with like a lot of repercussions and like training before we go in. But
So what was your experience like?
My experience is good. I actually met Salome at the mental health placement. So I'm currently doing a mental health placement right now. And that's where I met Salome it will keep you on your toes, mental health. I'm telling you, but it's so interesting to me. It was never like a thought of mine. All my placements were like IWK, maternity. That's all I applied for. And then because of COVID, they gave me this mental health placement. But I'd say it was a blessing. Like it was so good. I feel like mental health is important anywhere you go. The mental state is so important. So it was good for me to get this experience, to have it, so I can take it to any placement I go to. And now I'm actually like interested in mental health. So like it worked out. Yeah,
that was introductions. I have a few questions for these guys, and we're just gonna go in turns. Each of them is gonna pick out the first statement and then gonna answer it, and then we are gonna elaborate on that. Well, not me, but them, because they're more knowledgeable on it. So we'll start with Salome.
What do you find is the hardest part of being a nursing student / nurse? So I think the hardest part when I was a nursing student would probably be doing 4 years of nursing school with a handful, even less, Black people. So it's kind of like you don't have someone, or you only have 1 or 2 people to lean on who kind of really understand what you're going through. People who you can feel like you can talk to about your experiences, because other people don't have those experiences, so it's hard for them to understand what that is, what it's like being a Black student with everybody else being white, or minority as well. The hardest part of being a nurse, I could say the same thing. It's a all very white profession predominantly. But I think more so the hardest part about being a nurse is seeing the sick people, and especially the people who you can't cure or help, people who pass away, people who live with mental illnesses. It's just really heartbreaking. So you definitely deal with lots of cases where you just kind of think about that patient and their family for like weeks. So that would be the hardest part. But
I'd say the hardest part is very similar to Salome's. So the difference is I'm in the advanced track program, so meaning instead of 4 years, we complete it in 3 years. And when you first told me that, I was like, 3 years, when we graduated. It was so, I never imagined what that'd be like. I feel like it was more intense because we were trying to cram we only had 1 month in between like a semester, not even if we didn't have
3 weeks.
3 weeks. It didn't even feel like the 3 weeks. And then you're on to the next. And the biggest, I think one of the hardest things was the transition from work where you studied the stuff and then that was what was on your exam, wearing nursing. You would study your stuff, the 3,000 pages they told you to read, and that was enough. You got there and you were supposed to use like critical thinking. So like that was the hardest thing. And then on top of that, I was the only Black student in my class. So admitted at the time, I was the only Black student, and I found like I was like experiencing just a lot of like different treatment. And because I was the only Black student, I like always wondered, I didn't want to say to my other friends like, oh, I'm like, experiencing something. I didn't want it to make it seem like I was out, so I would never really tell my experiences because I didn't want to seem out or anything like that. So I would just stomach it. So I say that being the only Black student and like that transition and just not really feeling supported in that transition, I'd say that was the hardest thing.
My experience is extremely similar. Going from a high school setting into a 3-year program is not a joke. 3 years to do, and then you're expected to go out and like be immaculate when you practice. It's actually mind-boggling. Like so many times this year I have said I am not a robot. And then on top of that, with COVID, I'm literally in front of my computer all day. I'm really feeling like a robot. It's like clockwork. Get up in the morning, your bed is right there, but your desk is right next to it. There's no like separation. I feel like that was another thing. Like, first of all, being the only Black student, literally there's another Black student in our program, but she's all the way in Yarmouth. So like it was almost as if they were like just checking off a box of like, we need Black students here. When she applied to the Halifax one, right? And we both of us, we got admitted in like way later. Like a lot of my other friends who got admitted in, like they knew, and then I'm here sitting thinking, man, maybe I'm not gonna get into this program. And we both find out that we're in the program. Okay, whoop-de-doo. Wake up in the morning, I'm in Halifax, she's in Yarmouth. And I was like, bruh. So already, so that was my one excitement, because going into the program, like, I have people to look up to. Like, I have you, like, I have Kalkita, like, a lot of the people who have gone through nursing have told me, like, you will most probably be one of the few Black people. Lo and behold, I was the one Black person. And I really, this semester, only had one Black clinical instructor, and that was just by chance. Because my other clinical instructor got injured, so she couldn't teach us anymore, so our group had to split up. So then I got put into her group, which was literally a blessing, because it made me feel like even during my papers, like I could express myself more, and I felt it. So being the only Black student, and then it being online on top of that, that stress, I think that has been the hardest thing so far, because then also it's like ingrained in our heads that, like, because I'm Black, they don't want to see me prosper, so I need to work 30 times harder. So then that's already in your head, and then your friends are saying, I'm stressed, I'm this, I'm that, which is true, we're all feeling stressed. But then, like, I don't also want to say, like, I'm stressed too, because it's a different type of stress. It's a more, it's deeper. It's the school, it's it being online, but then it's like, I feel like I don't belong here. Like, and I'm fighting to prove to people that I belong. That's what's the most, that's probably the hardest thing. It's like trying to show people I should be here too.
Okay, it says, what do you find rewarding about being a nurse? So the most rewarding part is, like, just seeing how whatever you do impacts the patient. And, like, when you do something really good, I don't know, it, like, they appreciate it so much, and it makes you feel so good. I would say, like, during school, I was like, this stress, is it worth it? Like, I'm about to die for this degree. But then when I got to clinical, that's when I actually felt like, okay, like, it's for something. And when a patient says thank you, or you go out the extra way to do something for them, and you know it's impacted them, they remember that for not just then, but it goes past that for a lifetime. And that means a lot to me.
Honestly, it's when they're just very thankful. And sometimes I feel like a lot of the times we're in, like, really high stress situations, and patients who are sick they're not their best person, you know, they're cranky or they're hurting. So a lot of the times they are thankful, but they're not the best person that they can be, because they're ill. So when they say thank you and things like that, just the other day, I had the cutest patients. I was talking to the neighbor, and I was like, do you have any pain? And his other neighbor was like, not anymore now that you're here. Like, thank God we had a good one tonight. Like, oh, you guys are so cute.
I know.
But, like, little things.
So I haven't had any clinical experience, like, through nursing, but I think even, like, through volunteer and things like that, like, I've done some stuff on the side. The most rewarding thing so far has been, like, having that interaction with the patients to kind of, you bring yourself to, like, that same level of, like, you're a person, I'm a person, let's relate. I feel like that's probably one of the most rewarding things for me, just because, like, you give, and then also that you see that they're also inclined to take it from you, right? Because that's one thing with nursing, how, like, we always talk about, like, the authority level, and you kind of need to bring yourself so that you're all on the same level. And then it can be hard when a person is sick for them to want to take something from you, because they're in a helpless state, and they're usually never like that. They want to be independent. So then you being able to give that to them and provide it for them, and then them being grateful for that and being able to take that is something that I find very beautiful, like a very beautiful relationship.
Can I add to that? Which is honestly more important than people being thankful, is seeing their progress and how amazing they've done.
The best one. It's the best. It's very rewarding. In mental health, like, where I've seen it, when they stay, like, longer.
Inpatient.
Yeah, inpatient. Okay, yeah. So you really get to see the progress. Like, they'll start in one state, and then slowly, like, you see them get better. You'll come back from your night shift the next day, and they're a new person. And everything that you've implemented or tried to, like, help with, you see it working, and it's amazing to see them go through that transition. So beautiful.
Yeah.
Have you guys, like, had, like, any experiences where someone wasn't satisfied with, like, your service?
Oh, all the time.
Yeah.
Especially in
Yeah.
mental health.
Really?
Yeah.
Like what kind of things?
Well,
are they saying?
they're ill, so
Yeah.
they're not.
Yeah.
They're not.
They're
like,
the best version of
Yeah. So
themselves.
they, they yell at you,
Okay.
like they swear at you. How old are you, you little girl? Are you actually a nurse?
They say that. They do.
Yeah, but in on the surgical side, like they're not really. They don't say that, but they're just cranky.
Yeah.
But I did have one time when I was in Australia, and the minute I walked in this girl's room, and I had the patient, and I was like, oh well, it's a DF. This is what I'm used to. This is my unit at home.
Yeah.
This is what I do.
Yeah.
So I was like, this is perfect. And the minute I walked in, she was just not having it. She was so rude. And I definitely, I honestly think it had to do because of my color.
Yeah,
Of course.
which was
And
different.
in Australia, it's a little bit different, but
Yeah.
their scope is a lot more limited than our scope here. So going back there, nursing was a lot more easier. I was like, I got this. And then I get a call from work saying, you were sitting, like, just these ridiculous things. Like, I was like, oh, clearly, it was just like, I was like, what?
Yeah.
So we're lying now.
Even the person on the phone couldn't even rationalize somebody doing that. So
Yeah.
it was like,
Yeah.
she's like, I know, but I just wanted to let you know. I was like,
Yeah.
what? It's
Yeah.
mind blowing the things she said to this lady.
I
It's
think
like,
that's the
I was like, I
scariest.
had a feeling like, but
Yeah.
she definitely wasn't satisfied.
I think that's one of the scariest things too. Going in, knowing already in the program your color is a big factor of everything. Like, you already stand out, and then you go into this profession and they're used to seeing like a bunch of white people helping them, and then
You
you're
walk
like-
in,
and that's one thing for
chocolate.
me. Like, even my fears, like, I wear hijab and I'm
you're
black,
black.
and I'm like, bruh. And then if you little girl, like, so many, like, already I need to kind of mentally prepare myself for everything and anything I can hear, because I don't have a short temper, but like, I feel it. Like,
Yeah,
I truly
you take
feel
it
like I
in.
take it in, and I won't stop until like something is kind of done about it. So I kind of need to mentally prepare myself to be like, don't take it and stomach it, but like know how to deal with it in a better way.
Yeah.
I'm so worried, especially working with like long-term care, because I know there's amazing people, but then there's also people who were like a lifetime
with the
back,
racists,
So and like even doing volunteer at the hospital, like I faced some like racism and like those slight microaggressions. Like, aren't you hot in that? Or and I'm like, I said, if it's hot, it's hot. Like, he is heat. Yeah, maybe where you're from, it's hot. I was born here. You know what I mean?
That's
And
our
like always
favorite
have
question
like
to
maybe
me.
where you're from, it's hot, and it's like, well, I'm from here, and that's the only time that I'll tell people like, I'm Canadian, because I usually always love to go for it. I'm
Yeah, if
Sierra
you
Leonean.
ask me, I say I'm Sierra
I'm
Leonean.
Sierra Leonean. But if you try to like show me that I'm not from here, well, I had one guy come in literally, and I was just doing ambassador volunteering. He said, I used to have somebody who worked for me that was from Africa, and I was
Do I know the
like, he
continent?
saw me in two different situations
Yeah.
and said, and I'm just thinking, the country, right? Africa. So it's just those little things that you just kind of need to be able to deal with, but I just need to mentally prepare myself, because it's gonna happen. And like you said, with mental health patients, like, they're not their best self.
Yeah, so
right?
it
So you
really
need
does
to
come out.
maintain that professionalism.
Yeah, most definitely.
Yeah.
So another question that I have, is there like a specific mental illness that's like common in black people, and then like different
I was doing like
First
research,
stats,
depression.
Yeah.
Depression
Yeah,
is
stats,
very common among us. I think it was black males. I feel like because there's already this stereotype, oh, they don't do this, they don't do school, y'all are bad. And that stereotype covers up the fact that they may have an underlying mental illness, and that's why these certain things are going to, or like,
And also like you can't show emotion type of thing.
exactly,
Yeah.
right? So there's this stereotype that all these black boys don't do school, don't do that's why they don't do this and do that. But did you guys think about the fact they might have a mental illness?
Yeah.
Also, even with like black females too, like I know specifically with like African Canadians in general and African Nova Scotians specifically, because there's this idea that like the woman upholds like the household and like she takes care of the community and like takes care of her home. It's like always putting others before herself, that like even like they have depression, but they don't know how to actually pinpoint it and say, I have depression. It's more like I feel sad, I feel down, but it's always tempered because of all these other responsibilities that they have. So like it's very prevalent in the black community to have like depression, because it's just
Yeah.
something that is always pushed down, and I feel like there's already stigma around it, but in the Black community specifically, like there's a lot of stigma around it.
A lot of it. As soon as you say, like, I remember like when I have a friend and like she was like, oh, like, mom, I'm depressed. As soon as you say that to African parents, something, yo, what? Literally, like, they don't even like the word. I don't know if it stemmed from a place that they think that Africans or Black people have gone through so much that like they don't want it to seem like a mental illness is something that's holding them back or something. But that's something so normal to everyone. So I feel like they try to like downplay and be like, you don't have that. Jules, you need to recuperate yourself. You need to you know what I mean? Like they tried to be like, that's not it. So then a lot of people don't get help. Then they deteriorate major, and then they're like, she's a witch. Literally. Or they say something's wrong. Do you know what I mean? So yeah, people do, and I feel like this day and age, it's becoming more normalized that Black people do have mental illnesses because we are human. So now it's like starting to get like, this person has depression, and it's starting to get fixed. But back then,
I think my dad said growing up, he said there was only one person, a girl who he knew, who committed suicide, and that was because like she was being like abused, not just the 1-2 pick your stick, get beat here and there, you know what I mean, like actually abused. So she committed suicide, but he was like, it's not something that like they ever really heard of or talked about. And I think also like I'm very thankful because growing up here, but then also having that culture back home, my parents have also needed to kind of like adjust to the way things are here. So like understanding mental illness is something, and like my mom works in the healthcare field, and then my dad also worked like at the hospital as like a diversity coordinator. So like those are knowing and understanding like the Black community here, and then knowing that we as like Black people, like Black children, are growing up here and knowing that we're just as prone to anything. Just because even if we weren't born here, just because we are here, and like the external stresses, like literally your community is the ones that you find and bring. It's not like back home, you don't have everyone behind you, your entire neighborhood is safe type of thing. You know what I mean? So like they've done a really good job at like adjusting and being able to understand like mental illness and things like that. So I feel like that has been very helpful too, just the society. But it can be very dangerous. Even like some of my friends like who have been diagnosed with depression, like they're Black and their families are from like the continent, and they're just like, no, you don't have it. Or like, for example, like Muslim, they're like, oh, how's your relationship with God type of thing, and it's like that's something that's so dangerous. So it makes people not want to talk. Exactly. And you're like, oh my God, like what am I doing wrong? What am I doing wrong? Like why me? It's just so just a whirlpool of like going into a hole. But